Hey everyone, thanks for joining. Here with Doug, I want to give a little introduction to what we're going to be doing kind of on a weekly basis. We're going to be doing some cool videos. We definitely want them to be interactive. Today, we're going to learn more about Doug, his background, how he gets involved with the company. But we're definitely going to do a deeper dive, talk about some industry stuff, mix in some press releases, I'm sure, and definitely want to include Q&A type videos. So please let us know if you're watching what you want to see, and if you have any questions, we'd love to get them in. But Doug, first things first, how are you?
I'm great. How you doing, Jason?
Yeah, good. I know we were just chatting about a rough week in the markets, but either way seems like it's pretty needed. I know markets up huge, and then to come back a little bit is healthy. So to hop into it, usually I like to start with kind of where you went to school, first couple jobs, if that's if that's possible, and I'll kind of just poke some things as we go along. But
Sure,
yeah, if you want
sure.
to kick it off.
Sure, yeah. I grew up in the north part of Toronto, grew up in Willowdale. So, as a son of a bus driver, a TTC bus driver, I wasn't afforded the chance to head off to university anywhere but close to home. So, I ended up going to York University. I did my undergraduate at York, and then I stayed on and did a MBA. It wasn't even called the Schulich School of Business back then. It was the Faculty of Business Administration. So that's how long ago it was. To the point where I think my graduating class was about 42 people, and I think they graduate about 4,200 a year now. So it was
Wow.
the MBA class was a small class at that time, and but it was interesting experience, and I was one of the early recipients, so it was a good thing to have under your belt.
Yeah. No, that's awesome. So okay, so business I mean masters in business. Okay, now talk to me through the professional world. So what's your first
Sure.
job at a school?
I came out of school, actually, my first job was with General Motors. I went in
Oh,
to their distribution side. I worked with them for a little while. Wanted to get sales under my belt early. I was a little different than many in my graduating class who wanted to immediately go into marketing because we were tended to be marketing majors, and they all wanted to go into marketing and do that. I wanted to get sales under my belt early. Originally was some work with General Motors. Then I went and I started doing some sales work with a company called Baxter. Had a territory down in southwestern Ontario and sold to the hospitals throughout southwestern Ontario. So that was first job. I then did get the bug to go into packaged goods, as we all sort of get pushed towards in our early part of our career. So I spent some time at Pillsbury. I spent some time with Parker Brothers and General Mills Toy Group.
yeah.
So getting some exposure into more of, I would say, a traditional packaged goods type of background. Continued to into different opportunities. I had a chance to go into a company that I'd worked with very early in my career as a student. I actually started as a student with Baxter.
Yeah.
So I decided that healthcare was an interesting profession. It was one of those things that you got a good feeling working in healthcare, even if a job is a job in some cases. A lot of the jobs are similar in the strategy and the work you do. But when you're working in a field that you can go home at night feeling like you've done something to help people, I think it does give you that extra bit of satisfaction. So from that point on, I basically stayed in healthcare. So from early in my career, after a little bit of exposure to selling and into packaged goods, I moved into healthcare, and I've stayed in healthcare for virtually the rest of the last over 30 years.
How do you go from, so you get into healthcare, how do you get into the like public market space? How did this happen? Walk me through that kind of timeline.
So, I had always been in public market I wouldn't say I was certainly a capital markets person, but I was always in public companies. So I
Yeah.
was running fairly senior positions, vice president type positions with companies like Baxter. So publicly traded, we had our regular calls that you supported the executive team for calls with analysts, et cetera. So had an exposure more on that side of it, more so than at a public market CEO type of role. Did that. Spent a lot of number of years with Baxter, both here in Canada as their vice president of their infusion systems group, but then I went down to the US to be global vice president for the medical device business, the infusion systems group down in the US. Did that for a little while. It was not that long after 9/11. I had a couple of boys in high school. We weren't about to pack them up and take them south of the border, so I commuted back and forth, which got to be a little bit trying after a while.
Hmm.
I had an opportunity to come back to Canada and join an old colleague of mine who I worked with at Pillsbury early in our packaged goods career as well. Went over and joined him at Teva, and I ended up staying with Teva for 13 years, and I retired as the head of Teva in Canada in 2018. And I thought I retired, I should say, because it's like The Godfather; they keep pulling you back in. I got approached soon after the announcement of leaving Teva to join up with help out an Israeli medical pharmaceutical cannabis company who wanted to bring pharmaceutical formulations to the market. I spent time getting that business established. So a few things happened in the marketplace. A few things happened with COVID. I took what I would call a second retirement, and then got approached by somebody who I was familiar with on the Medivolve or on the QuestCap side, and they asked if I would come in first as an advisor, and then shortly afterwards as CEO of QuestCap, which evolved into Medivolve, and it's where I am today. So it was a bit of a movement from Teva through to the Israeli company. Teva also being Israeli, so I was used to spending a lot of time in Israel, and then my movement over into QuestCap and then Medivolve.
Yeah. Okay. Wow. And so retire and then find yourself somehow running the company. So incredible. I mean, talk to me. Curious. You mentioned sales initially, and it's funny. A
Mhm.
lot of CEOs have some type of sales background. Would love to hear like how important is a sales background in business, especially in the executive level of business. If you want to shed any light.
Sure. I mean, I think whatever we do, we're selling in some way, shape, or form. When I was at companies like Baxter, companies like Teva, I had to sell my ideas. I had to sell allocation of capital funding. I had to I had to go up against other regions to get support for the Canadian business. So in a lot of cases, you're constantly selling, and I felt that getting that early under my belt would be extremely advantageous. When you're in a senior position and you have large sales teams, I think it also adds credibility when they know that you once carried a detail bag, you were once a rep in the field as well. So I think that credibility also adds to your ability to identify with some of the things they go through as reps in the field.
Yeah. So now talk me through. So advisor to CEO. So walk me through like how does that conversation happen? And obviously, was it you came in, hey, I think I'd be a great fit, or was this we'd love you to be the CEO. We think you'd be a great fit. I'm curious, like just how that conversation happens from taking it on as an advisory standpoint to now running the company. So curious.
It was more the latter. I mean, I came in initially really to look at where they were going strategically. We made the move from being an investment issuer on the CSE, which was really focused on technology, climate, and medical.
Hmm.
My background and wheelhouse has been medical. So when I came in and saw the opportunities with medical, I really promoted the fact that we should be a single purpose company, hence the movement to a single purpose medical technology company named Medivolve. So that was sort of what created some interest. But it was more when I came in, they said, you know what, it might be a nice step if you could kind of step up and take the CEO role. And so I agreed, and that was the beginning of May last year. So
Yeah. No. Well, awesome. Well, hey, pretty crazy story. Even started from your early days in sales. It's funny. That's incredible. Taking out of retirement, run a company. So now, kind of my final question for you. As the CEO of Medivolve, what does your day to day, week to week look like? And I'm already taking questions from people. I already see people asking, what does Doug do?
well, I'll tell you, it's certainly different than it was in the past. I mean, everything we're doing is being done almost virtually remotely. We have a large team down in Las Vegas who run our collection site operation. That's a large part of our attention and our focus right now. So a lot of the work is done, with that team, making sure that we've got things coordinated. We're also always looking at new opportunities, new ideas. So we've learned to work remotely with all of this wonderful new technology we have. When I compare it to former positions, I would have been, sitting on airplanes for a good part of my job, and I haven't been on an airplane since February of last year, to be quite honest with you. And we've been able to continue to function and able to
Do you
continue to
find it more
move forward.
efficient, or like, because it's funny, you got people in mixed reviews, like to meet in person, but they're able to get a lot more done. Curious what your views on that are.
I miss the personal interaction without question, but at the same time, I think, and I think a lot of my colleagues say they work harder now because it almost the day just blurs in. You find out and you haven't stopped to grab a bite of lunch. You've gone right through till quite late. Weekends are like Groundhog Day. Every day seems to be just like a weekday. So it seems like that has blurred somewhat because of this whole pandemic. And I miss some elements of it. At the same time, I think if we're smart, we can work effectively and do so remotely.
Yeah. No, awesome. Well, hey, thanks for doing this. This is a great first video. And I invite anyone who made it this far, if you've got questions about Doug or his background, please drop it below. We'll do some fun Q&As coming forward. We'll do, a deeper dive into the company next week, some of the things you guys are doing, and go from there. But Doug, last chance, anything about yourself that you wanted to, let people know about?
Well, I have one little thing, and you can see it up on the wall behind me. There's two of them up there, but they're all for the same product. One of my claims to fame, and I can tell you, you don't get rich when you do this inside a company, but is I just had an old boss of mine at Baxter send me a notation of an ad from Baxter where they indicate that the number one selling drug reconstitution device in the United States is called the Minibag Plus, and the plaque up on the wall is the patent I have for the Minibag Plus. So I always laugh that $1.40 and that plaque will get me a coffee at Tim Hortons, but without the $1.40, no coffee. So it was a nice little legacy to have, but I've always enjoyed devices, so that's one of the things that I always look back on as being a fond memory in my career.
Well, question then for you, and maybe this is a great time to do it. I know we'll do a deeper dive, of course. What devices have you seen come up in your 30 years in the medical field? Anything interesting you want to talk about that you saw? Hey, this was cool, but maybe it didn't work out. Whatever, some cool little things. I know might have some stories.
We certainly in when you're in a company like a Baxter that is certainly working within medical devices, especially in infusion devices and ways to deliver drugs and solution to a patient, you're seeing lots of creative device type of manufacturing take place. Ideas are always great, but as an old boss of mine, a senior executive at the company in the US said to me, ideas are great, but are they economical and will the customer buy them? I mean, it's one thing to have a wonderful idea, but can you make it and sell it in such a way that it is answering a need and yet still affordable and answers the economic as well as the patient need? So, there's been a lot of very interesting things. Some of them never got to fruition because they didn't meet all of those parameters. But we were fortunate enough with the Minibag Plus, it did, and it was a very interesting project to work through. It was Canadian designed and invented, and then now it's the number one drug reconstitution system in the U.S. according to the ad we saw.
Well, awesome. Well, hey, no, that's some good insight, and I invite again anyone who made it this far, ask some cool questions. Maybe you've got some devices out there we can give some feedback on or something. We can make it pretty interactive. But Doug, thanks for joining. This was an awesome first video.
Great. Thank you very much, Jason. Appreciate it. It's been fun.